Hello guys, welcome to our channel PKR Vibes Career and Growth. First of all, thank you so much for your time. Today we will discuss about what is telehealthcare system in our medical building, and telehealthcare is also known as a telemedicine. We will discuss like what kind of equipments are using in this telehealthcare system, like digital equipments. And also we will discuss why this telehealthcare system is booming nowadays compared to general healthcare system, and also what kind of treatments or what kind of services comes under the telehealthcare system we will discuss now. Before that guys, if you are watching our video first time, if you're not yet subscribed, could you please subscribe our channel PKR Vibes Career and Growth, and turn on the bell icon so that you will get every our video as a notifications to your mobile. Hello guys, now we are discussing about what is telehealthcare system. And before that we have to know that telehealthcare system is also known as a telemedicine or digital health. Generally what happen here, doctor will provide the treatment based on patient medical conditions by using medical equipments or digital tools is known as a telehealthcare system. See here, we have to understand that patient no need to go to the doctor directly, nothing but physically no need to go to doctors clinics or doctors hospitals. So your service is delivered to the patient by using equipment. Here example I given like BP monitor missions, glucose meters or pulse oximeters or cardiology related meters or electronic watches, mobile apps or directly video calls and text messages. So here what happened, doctor is giving service by using this equipment. It's so much of easy, and here the beauty is the patient is no need to go to the hospital but service is done. So that is why healthcare system, especially telehealthcare system, is very important and very booming compared to general healthcare system. Here we have to understand that the remote people, rural people and aged people, and also the people who are suffering from long time nothing but chronic diseases like BP, sugar, asthma, this kind of chronic diseased patients are using this telehealthcare system very high compared to other people. And also uh, this example non-emergency services are there. At the time patient no need to go to the hospital, right? Generally the patient will give the get the service from the doctor by using this tele devices easily. General checkups, follow-ups, and also for example lab reports onlinely, they will send it to the doctors by using this telehealthcare system. And the interpretations, medical interpretations are very accurate because the devices will show the exact levels. And also the doctors will provide online pharmacy guidelines, what kind of drugs used, everything will be consulted, done by using this tele healthcare system. And also mobile apps is also vital role in this telehealthcare system. So that is why the telehealthcare system is very nowadays is updating these things. Even the dental services also using this telehealthcare system very high compared to, they are using compared to other devices like dental, all specialities, healthcare specialities are using this telehealthcare systems. Yeah, and also this telehealthcare system will reduce the cost. Why? Because patient no need to go to doctor every time, no need to give the co-pays to the doctor every time. And also the that cost of that co-pays and travel charges, everything is reduced. So and also time also will be useful to patients as well as the doctors. So that is why the tele healthcare system is very useful. And just we have to understand that the services, medical services given to the patient by the doctor by using this medical equipments or digital tools is known as a telehealthcare system. Okay, guys, now we are discussing about what are the telemedicine system tools or telehealth care system tools. So generally, the video calls, nothing but doctors will uh, scheduled by the patients by the video calls, and also the doctors will diagnose the disease, and doctors will verify the patient, I mean disease history to the patient with the help of video calls. And with the video calls, the patients directly communicate with the doctors, and also they will consultations will be done through video calls, and also the follow up regarding that particular procedure also done by the video calls. And the most common useful uh, health telemedicine tool is video calls. And also some people are also using chat, I mean text also they will use, but mostly the doctor will communicate through the video calls. And that is why I given as a telehealthcare system tool is like video call as a priority. Why? Because it is easily accessible, and the expressions and also the patient condition also will be known to the doctor with the help of video calls easily compared to other tools. Guys, in addition to video calls or text messages, sometimes patients directly call to the doctor, especially the remote consultations. I mean, they are from home and they are very distance to the doctors. At the time, patients will directly call. And also some people are there, they are suffering with the chronic diseases like diabetes, bp, heart issues. So those patients, they continuously uh, i mean uh, continuously they need follow-ups like a continuous monitoring. At the time they continuously call to the doctor, and every day they will check uh, their interpretations like what is a bp, diabetes levels. They will directly talk to the doctors, I mean over the phone calls. And sometimes emergency guidances directly they will in emergencies they are not go to directly video calls, right? Directly they will call to the doctor, and they will talk to their issues over the phone calls. Sometimes what happen, after surgery, I mean post surgery follow-ups also there, they are not able to take a video calls at certain conditions. At the time directly they will talk to doctors over the phone call itself. And but we have to understand that this will be very useful for the rural areas people, because they are not continuously go to the hospitals. And also we have to keep in the mind that this will help to them to save their time and money also, because example traveling charges. And also few elder people and also aged people, they are unable to go to physically to the hospitals due to their health conditions. So in that way these tools are very useful to the patients especially.
And other telehealth system tool is remote patient monitoring, RPM we can call it. Means the people who are at remote levels, they will uh, their health conditions monitored by using some kind of electronic devices. For example, the blood pressure device also they have at their homes, right? If they you have a like a glucose monitors missions at your residences and your at your homes, mean your means patient. So the patient will have their glucose monitors in their respective residences. They can directly call to insurances through video calls or phone calls. They will tell that what are the measurements for that kind of particular uh, interpretations. Like for example, they will tell what is a bp range and what is a blood sugar levels. They will, by using those devices, they will tell to doctors easily, right? So and pulse meters and some wearable monitors, like for example electronic watches and heart related devices. These all things will be coming into the digital healthcare systems. Why? Because they are actually given to the people who are very uh, uh, remote areas, and also they will also get the service by the doctor on time by using this digital healthcare systems. They no need to come to doctor just to check the BP levels or sugar levels and some other heart related issues, checkups. Also everything will be done by the tools and also systems equipments, right? So in that way it will be very useful to, and also these levels also very accurate because they are checking at their own timings at whenever it is required. So that is what I'm telling, it is very flexible and useful, and also it will be make like accurate. So that is what your electronic equipments become like a system tools, telehealth, for telehealthcare system. And guys, here mobile health apps also become like a uh, digital tool for this telehealthcare system. Why? Because they can track the symptoms through mobiles. And why? Because in mobiles they will put reminders to monitor their health conditions, and they will communicate with you know uh, their doctors with this healthcare apps, because the doctor also having their healthcare apps. So that will be easy to have track the information also. For example, patient history. What is the patient history it before taking the services, and how much a patient was cured. I mean, what kind of treatment a patient was followed by the doctor. That kind of all informations are provided in that respective healthcare apps. And also payment models also will be updated, and there are a lot of features will be added based on up to dates. But the thing is, it will be also very useful telehealthcare system tool in nowadays, because every insurances have their own respective healthcare apps they are offering to the uh, providers and also patients. So here the doctors also are offering their healthcare apps. So here healthy related applications also become like a booming nowadays, because for the accurate tracking information and uh, to uh, put reminders for their next follow-ups. Like this it will be very useful tool. Okay guys, now we are discussing about why this telehealthcare system is so important nowadays. Why? Because we already discussed, right? Time consumption is very less. They will save their own times. They will utilize this time of physical visit to the doctor in any another important things, right? So here time is very very important thing. And also cost. See, how can they reduce the cost? Means the patient not visited, the patient will reduce their travel charges, right? They are not visited to doctor. If they are connected through video calls easily, right? The traveling charges or other related expenses, whatever medical services to reach the doctor, they will give them. I mean, they should have to take in tokens, fee. This kind of all fees will be reduced. In that way we can reduce the cost and also time, obviously. This, I believe that the time and cost is a very very important thing, metrics for this telehealthcare system. And access, easy access, improves access to doctors and mental care health services, for example. That kind of things, they want access to specialists, right? That is why access is very important. And access means we also understand uh, how the patients will go doctors easy way. I can feel like access means easily approaches, that kind of base convenience. So especially for people in a rural areas like villages. And coming to chronic disease management. See, uh, okay, yearly once you are getting, or yearly once or twice you are getting some kind of disease, it's normal. but few people are there, they are continuously suffering diseases from long years, that will be known as a chronic disease. So how they are manage that kind of diseases, that things, especially chronic disease people, the sugar patients, and high hypertension people, high bp people, and also heart related and asthma people, this kind of peoples will not ready to reach every day to the doctors if it is required, right? Because they are already having diseases from long time, and also the severity is also high compared to other diseases. So this kind of chronic diseases will be easily managed by the telehealthcare system. Especially I believe that this will be very helpful to them, because doctor advise them to just call me in a phone, or just connect with the video calls, or just before connecting me, check your uh, health interpretations like bp levels and sugar levels. So in that way, this telehealthcare system is very useful for chronic disease management. So here we have to understand that they will monitor long-term conditions effectively by using this chronic care disease management. This will be helping to doctors as well, even to patients. Mostly, I believe that doctors will have more benefit on this chronic disease management, because they keep on providing the services every day to the patients, and every day they will visit to the doctor, and that will save the times to the doctors, as well as cost time, travel times also reduced by the patient. So this is why this healthcare system is important in nowadays compared to other uh, common like routine healthcare system is there, right? So compared to routine healthcare system, telehealthcare system is this much is important in nowadays. Okay, examples of telehealthcare services. See, primary care visits, PCP visits, or therapy services, suggestions, I mean online therapy suggestions, and electronic prescription refiles. So this all things will are comes under the telehealthcare services, and urgent care, virtually urgent care services, means virtual related services, and remote monitoring of diabetes, uh, remote monitoring of a diabetes and hypertensions and heart conditions. These all things will be comes under the telehealthcare service examples. So, and also guys, we have to understand that here the purpose of health telehealthcare system is like to reduce the cost, to reduce the time, and to manage the chronic disease management. Very very important, a remote monitoring of a disease like diabetes, hypertensions, heart conditions. So because they will provide digital tools to the peoples at residences, by that devices everyone will be get benefits. That's why uh, telehealthcare system in nowadays is very 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 useful to the people, especially in United States of healthcare system, and in other countries also followed by the same thing. And also in future we will get robotic services also. Compared to telehealthcare, robots also will be involved on behalf of doctors to make some kind of little services, robotic services already we have, but still that will be the upcoming next booming thing. Hey guys, if you felt our content is useful to you, kindly please do like our video, so that it will reach us many more needy people who are looking this kind of content especially. So that is, I'm expecting a small help from you. And also please do not forget to share this kind of content to your friends. And once again, thank you so much for your time, valuable time. Have a good health. Bye for now.